adalah ini biasanya terkait dengan gangguan-gangguan pada vertebrae, ya. Jadi ini nanti ada yang pemeriksaan ini terdiri dari ini. Coba nanti diperhatikan, nanti kalau ada diskusi. Jadi biar ada di paham dulu.
The cranial nerves, the postural reactions, the spinal cord reflexes, and finally evaluation of nociception if appropriate. Each portion of the exam should be performed in order to properly localize the problem. While gathering the history, it is important to watch the patient as they engage with their environment. This will provide a sense of their mentation, as well as provide insight into the patient's gait and posture. Here, while we are looking for any weakness, ataxia, incoordination, or lameness, additionally, we should evaluate the pattern of the gait, ensuring that the patient is not walking in circles, getting caught in corners, etc. Here, as we watch Lola walk, we can see that she walks in a straight line. Her foot placement is appropriate. She's not scuffing or crossing any of her limbs. Additionally, she does not appear off balance or lame. Her head carriage is high. Her neck, back, and tail posture are normal. The next step is to evaluate the cranial nerves. Initially, start by looking for facial symmetry, both visually and via palpation. Here you can see that her eyes, eyelids, nostrils, commissure are all symmetric. There is no inappropriate tilting or turning of her head. Then go through the cranial nerves in a systematic fashion. The palpebral reflex is generated by gently tapping around the eye, resulting in closure of the eyelids. The menace response is generated by creating a menacing gesture towards the face, also resulting in closure of the eyelids. The eyes are evaluated to ensure that there are no abnormal eye movements, such as a nystagmus, or abnormal eye placement, such as a strabismus, and that a normal physiologic nystagmus is present when the head is rotated into different positions. The pupils are evaluated for symmetry, and then the direct and indirect pupillary light reflex is evaluated using a bright light source. Proprioception is evaluated through a series of tests to evaluate the patient's awareness of where the limbs are in space. This can be evaluated through proprioceptive positioning and hopping, as seen here. The spinal cord reflexes are best evaluated with the patient resting in lateral recumbency. The withdrawal and patella reflexes are the most fundamental and should be evaluated in all patients. The cutaneous trunci reflex is most helpful in patients with thoracolumbar spinal cord problems. Next, the patient should be evaluated for spinal muscle symmetry and for spinal pain. It is best to start away from the suspected source of pain and gradually make your way toward the area of interest. The entire spine should be palpated, as well as performing a gentle range of motion of the cervical spine and tail. The final step is to evaluate for nociception, or feeling, or sometimes called deep pain. If the patient has voluntary motor function, then this does not need to be performed. If any limb lacks voluntary motor function, then this evaluation of nociception must be performed. This test is looking for a voluntary or conscious response from the patient, indicating that they felt the noxious stimuli that has been applied to the affected limb. The withdrawal reflex, where the limb is pulled up towards the body, does not indicate that deep pain is present, as that is a local reflex. The patient must look back or vocalize or otherwise indicate that they consciously felt the stimulus. I hope you found this video to be useful. Consider to download our free neuro exam form, which will allow you to be systematic during your examination. In general, performing the examination in a systematic fashion, doing it the same way every time, will yield the most information.
Oke, baik. Dari video ini, apa ada yang mau didiskusikan? Ada yang belum paham? Ada yang mau ditanyakan?
Hi, I'm Dr. Nick DePapa, one of the
Salva Dwi Firmansa, ada mau ditanyakan? Siapa?
Dari saya belum ada, dokter.
Belum. Aprilia Kurnia dan Nurul Chandra. Apa sudah paham ya? Kalau nggak tanya ini, saya tuh curiga. Paham atau bingung sih apa ditakut loh? Ada yang mau didiskusikan? Oke, kalau ini sekilas ya mungkin saya jelaskan. Jadi biar adik-adik lebih paham. Saya tuh soalnya takutnya adik-adik ini takut mau tanya, malu gitu ya. Jadi kalau tadi jadi kita harus komprehensif ya dalam melakukan pemeriksaan. Jadi tadi saya katakan harus saya pelankan ya karena tadi ada beberapa pertanyaan ya. Jadi tadi ini terkait dengan apa saja untuk pemeriksaan nervus itu bisa terdiri dari ini ya kayak mentation, kemudian gait posture, kemudian cranial nervous itu apa saja nanti diperiksa. Pada waktu postural reaction itu apa saja yang harus dilakukan, yang dilakukan diperiksa, kemudian spinal cord dan nociception. Nah, ini kita masuk ke mentation.
6 simple steps. Evaluation of mentation, gait and posture, the cranial nerves, postural reactions, the spinal cord reflexes, and finally evaluation of nociception if appropriate. Each portion of the exam should be performed in order to properly localize the problem. While gathering the history, it is important to watch the patient as they engage with their environment. This will provide a sense of their mentation.
Jadi mentation ini lebih ke arah bagaimana kita memeriksa hewan tersebut tanggap terhadap stimulasi dari luar. Misalnya biasanya yang kita lihat tuh dia alert itu dia ada respon kalau ada misalnya kayak di cek itu diajak jalan gitu dia ngerespon ya, itu namanya alert. Kemudian ada letargi itu males, lentruk gitu, itu dia tidak tanggap terhadap stimulasi ya. Kemudian ada stupor biasanya ya, stupor itu sudah nggak, maksudnya dia masih sadar tapi sudah tidak peduli apapun. Kalau letargi masih lemas tapi kalau dia sudah semacam kalau stupor itu sudah mau masuk ke arah koma ya. Jadi lebih ke arah dia memang sudah tidak sadar ya. Itu hal yang bisa kita lihat reaksinya kalau kita berikan rangsangan itu dia masih ada stimulasi masih ada tanggapan atau tidak ya. Nah, ini gait and posture ya.
Here, while we are looking for any weakness, ataxia,
kita biasanya lihat ada ataksia tidak ya, ada kekakuan, apakah ada rasa kakinya diangkat ya pada waktu berjalan, apakah kakinya menapak semua, apakah ada yang dia ditekuk ke dalam atau kaku. Nah, itu dilihat itu dari gait and posturnya ya. Tuh. Nah, ini ada cranial nervous. Nah, cranial nervous itu berarti kita periksa pada semua nervus yang menginisiasi pada daerah kranial ya. Biasanya kita periksa mata, cuping hidung ya. Kemudian jauhnya apakah kalau kita buka itu dia lemas atau daya kaku, itu bisa lihat. Nah, ini kita melihat refleks palpebrae ya. Ya kalau kita cek gitu, apakah dia ada refleks palpebrae-nya. Nah, ini matanya ada, kalau misalnya ada gerakan dari mata, nah dia ada kedip apa enggak, itu refleks palpebrae ya. Ya, nah kemudian ada kayak strabismus atau ada nystagmus, nah itu dilihat posisi matanya apakah ada kelainan atau tidak, ya itu adalah kita melihat strabismusnya ya. Nah, ini kita melihat refleks pupil ya, kalau dikasihkan pencahayaan itu apakah dia masih ada refleks atau enggak gitu ya. Nah, ini tes refleks ya. Nah, ini
This
dia
can be evaluated
melawan
with
dah.
great
Kalau
precision
biasanya kalau
and
dipegang,
positioning in
nah ini
practice.
tes apa kalau pada kaki itu pada ketiga ya
Final
ada
reflex
wheel
is
bearing,
by
ada
patient resting
hemifor apa hemipara ya, kemudian ada yang apa namanya kalau wheel bearing itu diangkat tiga ya. Ini ada refleksnya, kemudian ada hopping. Kalau hopping itu tiga kaki tadi diangkat, artinya dia masih bisa jalan enggak, gitu ya.
And for spinal pain. It is best to start away from the
Ini ada
suspected
nervnya,
pain
ada rasa sakit
and
tidak kalau
gradually
kita
make your way
pijat-pijat
toward
pada
the area of
daerah lumbal
the entire
ya,
spine should be
pada
palpated,
daerah
as well as
cervikalis, ada
the
rasa sakit apa
junction
enggak
of the
gitu.
cervical spine.
Nah, ini apakah ada terjadi heat fail ya dan sebagainya ya.
The final step is to
Nociception
evaluate
ini
perception,
lebih ke arah
feeling,
apa namanya pemeriksaan rasa nyeri
patient
ya,
voluntary motor
deep
function,
pain
and this
ya,
does not
ada rasa
mean
nyeri yang
pain
paling
is
dalam
fault.
ya. Itu biasanya, nah ini yang disebut dengan wheel bearing ya. Kita angkat kaki belakang, kaki depannya masih bisa jalan apa enggak. Nah ini dijepit kayak gini ada rasa sakit berarti aman, tidak ada. Biasanya kalau pada sakrum itu, nah pada nervus sakrum ini dipin ya. Apakah pada lumbal kayak gitu ya. Ini diperiksa.
Does not indicate that deep pain is present, as that is a local reflex. The patient must look back or vocalize or otherwise indicate that they consciously felt the stimulus. I hope you found this video to be useful.
Oke, itu ya jadi penjelasan dari video ini. Ada yang ditanyakan? Sudah cukup jelas ya. Kalau tadi nggak ada yang bertanya, berarti kalau sudah saya jelaskan tambah jelas mungkin atau tambah bingung. Semoga tambah jelas ya. Oke, baik. Kemudian ini adalah yang untuk hewan besar kita contohkan adalah kuda ya. Bentar. Oke.
Today we'll discuss the neurologic examination of the horse. A
Sudah masuk
neurologic
kan?
examination is conducted when we're concerned
Sebenarnya sama ya apa yang diperiksa, tapi nanti coba kalian adik-adik perhatikan.
may not be functioning correctly. That dysfunction could be as subtle as a change in behavior. For example, a horse that's normally active and alert becoming depressed, or be as severe as stumbling and the horse having trouble standing. The most severe manifestation of a neurologic disorder would be with the horse laying down and unable to get up. A neurologic examination systematically evaluates different portions of the nervous system and assesses whether function is normal or abnormal, and if abnormal, to what degree of abnormality, severe or mild. As part of the neurologic examination, we always include a history so that we understand if there are any new items in the horse's diet or exposure to other types of illnesses or diseases. An example might be equine rhinopneumonitis or EHV1 that can cause neurologic dysfunction and starts as a respiratory infection. For example, did the horse go to a horse show? Were there coughs? Did the horse ever have a fever? Those sorts of items are really important in narrowing down a diagnosis. But the physical exam still goes through a systemic examination. The examination will usually start with observing the horse either free in a paddock or in the stall. Does the horse move normally? What's the level of alertness of the horse? Is the horse head pressing, for example? When the horse turns, does the horse stumble or seem unaware of the limb positions? From that distant exam, we do a close-up exam. we will usually start with evaluation of the cranial nerves. And those are the nerves that originate in the brain and go to different parts of the body, particularly the head. We check to see whether the horse can blink its eyes. We check to see if the horse can feel a finger in a nostril, whether or not the horse can use its tongue, whether the horse can swallow. Those sorts of evaluations are part of the cranial nerve exam. The next step we usually take will be to do mild pin pricks on the skin. Normally, the horse will respond just as it would with a fly on the skin by shivering the skin. And we assess whether that's present to a normal or abnormal degree throughout the body. We check to see whether the horse has normal strength of the tail. If the horse resists tail movement when we grasp it, that's usually quite normal. If it's completely flaccid, then that's abnormal. We also check whether or not the anus has normal tone by a mild prick, normally such as just placing a thermometer in. We see that there's muscle strength in that area. Another thing to assess, and it might be done during the history, is whether the horse can urinate. Is the stall wet to a normal degree? And has the horse been observed to urinate or not? From those general exams, we assess how the horse manages its self-carriage. We walk the horse back and forth in a straight line. Does the horse track normally or abnormally? We may introduce a log or a rail on the ground or a curb and have the horse walk over that. Can the horse tell that there's an obstruction on the ground? We can also weave the horse back and forth over objects like I just talked about. By doing that, the horse has to fully assess its location in relationship to the obstacle. Does it trip over the obstacle? Does it stumble during the turns? Those sorts of things are important to assess. The next part of the exam is to pivot the horse on its hind legs. Doing that will assess what we call proprioception. Can the horse tell where its limbs are? Normally, a horse will mildly cross over its back legs as we pivot in a tight circle. And it should do that without reaching out far with the outside limb. Reaching out far is called circumduction, and that's an abnormal finding. The next thing we can evaluate is limb strength. We can do that in the forelimbs by pushing on one shoulder, pushing the horse over onto the opposite leg, and the horse should normally resist and not collapse or act weak. We can do the same for the hind legs by pulling the tail and walking the horse forward. Can the horse support its weight well as we shift its weight onto one limb? Another item of the exam is to walk the horse up and down a slope. To properly manage a slope, the horse has to take in visual information and its limb sensation and compile that information to keep it from stumbling. Sometimes we'll do portions of the exam with a towel over the eyes to eliminate the visual input that may show more subtle abnormalities in proprioception and strength and full use of the horse's body. We record those findings and make an assessment as to whether additional information is needed to make a diagnosis. If these findings show abnormal neurologic
Oke. Ada pertanyaan untuk kuda? Sebenarnya pada prinsipnya sama ya. Kita melihat gerakan dari kakinya, ada rasa nyeri enggak, tadi ada di kulit ya, itu juga akan membantu ada rasanya karena nanti kalau kulitnya tidak respon terhadap adanya rangsangan, misalnya digigit apa lala dan sebagainya, dia nggak akan berasa, nah akhirnya jadi luka. Terus apa tadi, hmm, didorong dia kuat enggak, apa nahan, apa namanya, dorongan itu kan menunjukkan kakinya masih kuat. Kalau kakinya tidak kuat didorong gitu, dia pasti sudah ambruk ya. Sama dengan tadi kayak tilnya ditarik itu juga sama. Terus pemeriksaan mata ya, mata itu apa namanya, di gini kan, itu hampir sama dengan yang pada hewan kecil ya. Nostrilnya diperiksa, kemudian lidahnya dijepit-jepit, dia ada rasa sakit apa enggak. Kalau dijepit-jepit ada, dia menolak, itu berarti ada rasa sakit, berarti aman, berarti tidak ada gangguan saraf di situ. Hampir sama sepertinya pemeriksaannya ya, tapi kalau apa namanya, kalau anjing tadi kan ada wheel bearing, ada hopping, ada handbring itu kan. Nah kalau ini tadi nggak ada yaitu, soalnya kalau pada hewan besar kalau kamu melakukan kayak hopping yang diangkat 3 kaki itu juga berbahaya, nanti dia jatuh. Gitu. Ya jadi cuman dari ekor ditarik kayak gitu-gitu. Ada yang mau ditanyakan? Atau sudah cukup? Apa sudah cukup? Anissa, ada yang mau ditanyakan?
Izin bertanya dokter, kan tadi untuk di kuda itu yang
Halo, Anissa, Dea Larasari. Apa sudah cukup paham?
ya halo,
Halo?
kedengaran tidak?
Ya,
Halo.
paham? Ada yang tanyakan?
Ya,
Kok
saya mau izin tanya dokter.
kecil banget ya suaranya?
Halo, halo.
Ya, oke, Anissa.
Saya izin bertanya dokter.
Mm-mm.
Eh, apa sudah terdengar ya dokter?
Sudah?
Oke. Tadi kan di waktu yang di pemeriksaan di kuda itu untuk yang di pain-nya, apakah hanya di area sekitar punggung saja ke belakang ya dokter? Untuk area abdomen ke bawah gitu bagaimana dokter?
Kalau kuda itu soalnya relatif apa, dia tidak tahan sakit ya dia. Ya. Dari atas itu kalau sudah dipegang gitu, kalau dia rasa sakit berarti memang sudah ada gangguan pada ini apa namanya, pada vertebrenya. Jadi kuda itu memang relatif dia tidak tahan nyeri. Kalau dia kalau pin di pinnya itu, kalau itu biasanya langsung ambruk biasanya. Kalau pada hewan kecil dia akan relatif lebih tahan sakit gitu. Jadi memang superficial, karena kalau memang sudah sakit banget biasanya dia ambruk. Kalau sudah di abdomennya nyeri nggak akan bisa berdiri dia. Gitu. Itu ya.
Baik,
Oke.
terima kasih dokter.
Sama-sama. Ada lagi? Ada lagi? Kalau tidak ada, baik, kita lanjut. Saya juga akan membimbing praktikum basah hari ini. Jadi kita akhiri kuliah, bimbingan praktikum hari ini. Semoga ini bisa mendatangkan manfaat buat adik-adik. Nanti teorinya lebih banyak dipelajari. Tadi, oh kalau